Good morning, good evening, good afternoon. This is Dr. Garais, BIO116, Anatomy and Physiology 2, Laboratory, Unit 1. And we're doing heart and a little bit of blood. So let's do the relatively more complicated thing first, which is the heart. First thing you will need to know, of course, normal heart rate is 60 to 100 beats per minute. You also need to know your waves, P wave, QRS complex, and T wave, and what they mean, and if can you identify them. Now, when we're looking at the heart, know your parts. Let's do external parts first. Of course, up here, that is your apex. Your great vessels here, that is your base. This right here and is your right atrium, and let's color that blue. And if you see this little outpocketing here, that is your auricle, and that is also part of your atrium, so we're going to color them together. And if that's your right atrium, you know the reason why it's your right atrium is because your superior vena cava and your inferior vena cava lead right to that particular chamber. If this area here is smaller than this big area here, that means this right atrium is right next to your right ventricle. Your ascending aorta into your aortic arch, let us color that red. Okay. Of course, we're deoxygenated, oxygenated, and this is your right ventricle. Therefore, this structure right here is your pulmonary trunk, which will lead into your right and left pulmonary arteries. And let's color that a different color, blue, to connote deoxygenation, or red blood cells carrying carbon dioxide. Right here are your coronary arteries and veins, and not really for identification for the anatomage, but definitely you'll need to know your coronary arteries and veins for your laboratory identification / matching on your midterm, which will happen at the end of week 3. So those are all the anterior structures of this particular heart. And you can see for this particular patient, the anterior structures are on the right side. So let's now look at the left side. Let me stop this, close this out, and let's look at the back part of it. So when we look at the back part, the one thing you'll notice is the aortic arch. Let's remove this. So I remove it by using my Explore tool, and then picking that button, and then removing your descending aorta. So it goes ascending, then to the arch, and then in the posterior view, descending aorta, which is here. Now, we already identified this as your pulmonary trunk. Pulmonary trunk will then go into a left and right pulmonary arteries. So let's look at that. Whoopsies, wrong thing. Let's now label this as your pulmonary artery, and then let's give that the same color. So that's your right pulmonary artery, and if you have a right pulmonary artery, you're going to have a left pulmonary artery. Now, if you'll notice that when we're looking at the posterior view, the right side of my patient is over here, and the left side of my patient is over here. Make sure you know and understand that part. Of course, at the front, you have the small chamber here and a much larger chamber here, and now we're on the left side, so this has to be the left atrium. So let's color the left atrium kind of like pinkish, because it is oxygenated. So if that's the left atrium, this has to be the left ventricle. Now, if you look at the left atrium, it has two sets. You have a set of blood vessels coming into the left atrium on this side, and a set coming from that side. Of course, this will be your right pulmonary, and that's your pulmonary vein coming from your lungs, and that's your inferior, and then of course this will be your superior, and they're all going in here. And if you have that, you'll also have that here as well, a left superior, left inferior. So it's going to go like that, and this side is going to go like that. So remember, identify this as your left atrium and these items over here as your right pulmonary vein, and these items here left pulmonary veins, and that's the inferior part. So you have your superior part and inferior part right here. This thing right here is part of your coronary arteries and veins. It's part of the venous side of the show, and this thing right here is your coronary sinus, okay, connecting into your middle cardiac vein, which goes down the back of your posterior interventricular sulcus, which separates the right ventricle from the left. Okay, so let's now bring it back to the first part, and now let's talk about internal structures. So, internal structures, you know, I have to cut open. So the first set of structures that you can really think about is your AV valves, or your atrioventricular valve. So we go into the clipping tool, and then if you notice, I will start cutting longitudinally. Then I remove this part, then you know I'm going to ask about internal organs or internal structures of the heart. So right here, they put in your SA node, AV node. You will notice that the right atrium, or the atrial wall, is very thin and very smooth, versus the ventricular wall, which is very thick and very rough. These rough branches are known as trabeculae carnae, and they are specific for your ventricles. Now, of course, we're on the right side, so this has to be the tricuspid, connecting into these ropes or cords. That's your chordae tendineae, and then connecting into your papillary muscle. So know your right AV valve, which is your tricuspid, chordae tendineae, and your papillary muscle, which is right here. So those are the internal structures. And could I ask the other side? Sure. This was my left atrium, this is my left ventricle, so this has to be my bicuspid. All right. Let's put this all back to normal. Click this, click on this button. Now, if I'm going to ask about the semilunar valves, I'm going to have to cut here near my aorta and near my pulmonary trunk. So of course, if there is a semilunar valve associated with your aorta, it is your aortic semilunar valve. And the semilunar valve associated with your pulmonary trunk has to be the pulmonic or pulmonary semilunar valve. So let's see what that looks like. Have my clipping tool. I cut here at this level. So I can see this here. You kind of see valves in here. But definitely for the pulmonary trunk, you see it. Right? These are your semilunar valves. Pulmonic semilunar valve. And then the aortic, let's see if we can cut it a little deeper. And then of course your aortic semilunar valve, because this is your aorta. We colored it red, and that's the semilunar valves there. So, aortic semilunar valve, pulmonic semilunar valve. And you know that they are associated with the two major arteries, one coming from your right ventricle, that's your pulmonary trunk leading into your right and left pulmonary artery, and of course your aorta coming from the back, and that's coming from your left ventricle. And remember, they are very different from your AV valves because they don't have any chordae tendineae. They don't have any papillary muscles associated with it. And like I stated in class, they kind of look like ashtrays. So let's now look at some blood. Now, if we're looking at something that's microscopic, like blood, of course, we're going to go to the histology, double click on that, and there's different ones, eosinophils, basophils, but the first thing we're going to look at is, let's look at blood, let's look at a blood smear. Let's see, with annotations. So we could ask you things. Oh, neat. Well, definitely the E is, of course, red blood cells. Okay? Now, you see these little specks of dirt? Let me point an arrow to it. So you see these specks of dirt? Those are, of course, not full cells, but they are your platelets, also known as your thrombocytes. Remember, they're sticky pieces of gum, and platelets are essentially fragments from a larger cell, which is your megakaryocyte. And red blood cells with the classic, what do you call that? It has the classic biconcave disc shape. Therefore, it is anucleated, it has nothing in the middle, but a protein called hemoglobin. Now, if we look at this white blood cell, how do we know they're white blood cells? They're colored purple, and they're like twice, almost 3 times the size of your typical red blood cell. And you could see, this is a normal patient, so on this peripheral blood smear, not a lot of things going on, and that's how it should be. And we're looking at this is chicken dinner or multilobular. So the answer to this, of course, is your PMN, also known as your neutrophil. Okay. Now let's look at some other, another histology, and let's look at some more blood. And why does it want me to look at blood? Okay, here. Now the best pictures, I believe, are from your lecture. So let's look at some different granulocytes. So now we notice there's definitely a granulocyte. There's granules everywhere, but it's not bilobular, and it's also not really multilobular, right? So this has to be the what? Basophil, right? Because the neutrophil is multilobular, or it kind of looks like 3 pieces of chicken, in my opinion. And then your eosinophils are bilobular, which looks like 2 big globs of purple. But this is granular, definitely, and a whole bunch. So this is a nice example of your basophil. Let's look at something else. See if we can get other things. How about this one? This one is definitely bilobular, right? Do you see how there's like one big fat section, this other section? So this is a eosinophil. So therefore, this particular patient probably well, if there was more of them, have a bunch of them, they probably have some sort of allergy going on. Here, and another basophil. Let me try to find a good PMN. Now, let's look at another eosinophil. Oh, these are garbage. This is not good. But of course, red blood cell, platelets. That's the yucky one. Monocyte news. Let's look at some. Well, let me try to find a neutrophil for you. Okay. Well, let's instead of hanging around, let's look at a lymphocyte. So when we're looking at the lymphocyte, Do you see how it's kind of fuzzy? Like there's granules, but it's less fuzzy. And if you look at it, the nucleus covers the majority of the cell size. And so that's how you can tell what a lymphocyte is. And also you can kind of tell the size of it. Now let's look at a monocyte, how it differs. Now, if you look at the monocyte, it's still, this could trick you that it's multilobular or bilobular, but you really look, it's just like, I don't know, it looks like a Lululemon symbol to me, but it's just one big one. And of course, it is an agranulocyte because it's fuzzy. You know, the granules aren't pronounced. So this, compared to the other one, this is definitely a monocyte that will eventually turn into a macrophage. Let's see if we can have a macrophage. No, they don't have one. But it would look just like that monocyte, but it would look what? Huge. All right, that concludes our Unit 1 laboratory, at least for the Anatomage. Another thing that you should look into is also blood typing, and that'll be on a separate video. I think I have an old video of it. I'll try to get it to you guys. All right, have a good one. This is Dr. Garais, signing off.